So a hiatal hernia is basically when a portion of your stomach has slipped up into your chest. And that can range from either being a small slip or what we call a sliding hiatal hernia, or a large paraesophageal hiatal hernia when a majority of your stomach or sometimes even a portion of your colon can slip up into your chest. Oftentimes people can have chest pain. They may have acid reflux disease associated with that. We actually specialize in taking care of hiatal hernias, especially the large paraesophageal hiatal hernias. We tend to perform these operations most often still through a thoracotomy or an open incision, mainly because our biggest concern is recurrence. And some of the data suggests that recurrences are lower when you do the open approach, and that's the reason we favor that. Having said that, we also do the minimally invasive approach through the abdomen and are comfortable doing both methods. Hiatal hernias are oftentimes diagnosed when people present to the emergency room with chest pain. Sometimes if someone has acid reflux, they may get an endoscopy that shows the hernia, or they may get some other radiology test that shows it. When people do have a hiatal hernia, especially a large hiatal hernia, there is a small risk of strangulation from the hernia or from the stomach twisting on itself, and that's really the reason that we usually recommend surgery even if someone doesn't have any symptoms from it. Most commonly though, people do have symptoms of either chest pain, early satiety, meaning they get full easily when they eat, acid reflux, and sometimes people can present even with just anemia or low blood levels because of chronic bleeding from the stomach due to that hernia. Hiatal hernias are really only treated by surgery, especially the large hiatal hernias that we repair. And so again, the way we favor treating these is usually through an open approach going in between the ribs, but also we can treat it through a minimally invasive approach through the abdomen.
And is there a reason to choose UM over another center?
I think the reason to come to the University of Michigan is because of our expertise in hiatal hernias and our ability to treat these by both methods. I think that a lot of surgeons in the community and elsewhere are only familiar with treating these through a minimally invasive abdominal approach, and we tend to see a lot of referrals for recurrent hernias or people who have had the laparoscopic approach attempted, but it's been unsuccessfully attempted.